So there was a career counseling happened when I was in school, and it said that topmost profession was, the choice was doctor and second was lawyer. So probably a lawyer, but I don't think I can imagine myself not being a oncologist. And that's because I am very genuinely happy being an oncologist. I love to have a conversation with patients. I love to treat them. I love to sit hours with them to understand their emotional self and their problems. I think it gives me the genuine happiness, and I find a lot of peace in that. So I think it's what's keep me going.
Now it's time to tune in for a glimpse into a person behind a white coat. So, sir, what's one myth about cancer that you wish people would stop believing?
That it cannot be cured. I definitely believe. I just hope that they just come to understand it can definitely be cured. Rather, 90% of them are easily.
So, if you could invent one gadget to help patients, what would it be?
I have no idea. I'm not an inventor. So, but yeah, sorry, I have to pass that one because it'll be a different. It'll be
Maybe a
difficult.
wonder drug. Right.
So now when you ask for it, I think if we as an industry can collaborate and do research in India, which I think is my dream,
Yes.
if we can develop, basically drugs have two parts to it. There is a discovery to it and there's a development to it. In India, we don't discover drugs. We generally help them develop.
How would you unwind after a long day in oncology?
I was a keynote speaker in one of the national meetings and somebody asked me, how's your work-life balance? And I told them it's not there.
It's not.
I work too much and my work-life balance is a bit difficult. But then I have two beautiful daughters. One is 11 years old, one is 1.5 years old. So I wish my 11-year-old would stop growing and my 1.5-year would grow up sooner. So I love to spend time with them. I love to take them out.
If you weren't an oncologist, what would you have been doing?
I've been in medicine for almost, I think it's almost 15, 17 years now. It's very difficult to answer. So if I have not been an oncologist, I would have probably been a physician because I love medicine as an internal medicine. Had I not been a doctor, I probably would have. So there was a career counseling happened when I was in school, and it said that the topmost profession was, the choice was doctor and second was lawyer. So probably a lawyer, but I don't think I can imagine myself not being a oncologist. And that's because I am very genuinely happy being an oncologist. I love to have a conversation with patients. I love to treat them. I love to sit hours with them to understand their emotional self and their problems. I think it gives me the genuine happiness, and I find a lot of peace in that. So I think it's what's keep me going.
Cancer care is changing in India, driven by technology, early detection and diagnosis, leading to better treatment and, of course, patient-centric approach. Get ready for a powerful conversation with Dr. Bhuvan Chugh, medical oncologist, Max Super Speciality Hospital. And in this episode, we'll explore the landscape of cancer in India, what is the prevalence, and how AI and liquid biopsy are helping us manage the cancer patients better. Welcome, Dr. Bhuvan.
Thank you. Thank you so much, Dr. Manisha, for having me. It's always a pleasure to have a conversation with you.
So, sir, what are the key cancers prevalent in India? Is it more common among men or women? And what are their regional differences?
Interesting question. You know, I was at a conference earlier. I think it was a public conference, and I was made aware of the fact that it's more common in women than in men, and I was rather taken a surprise. And then, when I went back and did read about the study which they were mentioning, it's actually right that in India, the cancer incidence is higher in women than in men. And I feel that it's, so for in women, the most common cancers are breast cancers and cervical cancers. And for men, the most common cancers are oral cancers and lung cancers. So yes, the incidence per se is higher in women, but it's also because a lot of it is being driven by the breast and cervical cancers, and which is a fairly common cancer which we come across in our clinics. The male usually suffer from oral cancers, lung cancers, and gastrointestinal cancers. For the females, the other cancers are ovarian cancers and obviously the gastrointestinal cancers. But among the two, females do have a higher prevalence. And I would like to add something which is very interesting here is, so for the males, the two cancers which are there are completely preventable. So for a male who stops chewing tobacco, he'll possibly not get an oral cancer. And if he stops smoking, majority of the lung cancer will not be there. For females, among the two cancers, cervical cancer, the second most common, it's completely preventable by vaccine. And the breast cancer can be detected at a much early stage by a routine screening mammogram. So what I meant to say was, out of the 4 most common cancers in Indian males and females, 3 are completely preventable and 1 can be detected early, and which I think gives us an opportunity to obviously bring down the incidence significantly. And with the early detection, it also gives us an opportunity to reduce the morbidity as well as the mortality. That's the disease burden and the chances of death because of the cancer.
Rightly said, sir. We have vaccine, HPV vaccine, especially for the cervical cancer, and tobacco chewing is something which can be easily prevented. And of course, the smoking, if we avoid that, we can just avoid the lung cancer. Right, sir. So how early detection can change the course of cancer treatment, and what are the screening guidelines people should be aware of?
This question can be answered in the terms of the data which we have, otherwise in a general sense also. Because I do a lot more breast cancers, so I can obviously say out the numbers of breast cancer in a much more realistic way. Breast cancers, so any cancer will probably have 4 stages, 1, 2, 3 and 4. So when you are able to detect and treat cancer in a stage 1, the majority of cancers will be low risk cancers. And the chances that the female would have a normal lifespan and a normal life are upwards of 93%. In a stage 2, you may have a slightly higher risk of recurrence, and that becomes a high risk group in that case. And the cancer chances recurrence increase to somewhere around 14 to 15%. And the moment you hit the stage 3, it's considerably higher, upwards of 25-26%. And for stage 4, obviously, you're talking about a non-curable stage, and the chances you'll be cured of cancer is rather nil. So what happens is, when you detect the cancers early, not only the chances of recurrence are low, that means a complete cure, a complete definite long-term cure is certainly more possible when you catch it early. Also, the number of modalities of treatment required are significantly lesser. And when you have a conversation with patients, each step of the treatment modality adds to the emotional, financial burden to the patients. So when you have a breast cancer patient sitting with us, it's so heartening to say that all you require to do is get a surgery done. And then if you choose to conserve your breast, we'll do a radiation and put you on a tablet for next 5 years for a stage 1 cancer. While for a stage 3 cancer, you'll probably end up doing chemotherapy first, and then you will be doing surgery, and then you'll be doing radiation, and then you'll be doing 2 kind of pills in the adjuvant setting. So what I meant to say is, the amount of treatment, the number of drugs, the duration of treatment is considerably shorter for early stage 1s as compared to the later stage. So as far as the guideline recommendations are concerned, an annual screening mammogram, which as per the studies available is considered safe once a year starting from the age of 40 years, is generally recommended for breast cancers. Similarly for colorectal cancers, and similarly for prostate cancers, cervical cancers, there are certain established guidelines which are readily available on the net. And what I would recommend is this, and you don't even need to meet an oncologist. You just need to meet a preventive health checkup person who will help you with these guidelines. For example, a cervical cancer, starting at the age of 30, you do a pap smear in which you check for the cytology, and HPV serology is done once in 5 years, which is all what is required. Colonoscopy starting at the age of 50 years, once in 10 years is required. So all of these are standard guidelines which are there, readily available. All it requires is, when you go for a PHP check, which we all do, having a conversation with your physician there would answer most of these queries.
Rightly said, sir. And breast cancer is something which can be easily detected with the help of mammograms. And I think early detection is the key, and lesser number of drugs and longer survival. Definitely. So, how lifestyle changes and preventive steps like vaccination, which we have been talking about, like HPV vaccine, and tobacco control can save lives? Half of this you have addressed.
So, yes, I've already touched upon that,
Yeah.
Already. So, for example, majority of the oral cancers, and in the oral cancers which we in India face is different from what is seen in the Western countries. The oral cancers which we end up seeing, it's more of oral anatomically, which is different from what I think you are trying to say. For me, oral is buccal mucosa, tongue. So all this is definitely secondary to the tobacco chewing, the betel nut chewing which we have in India, which is very prevalent. If we are able to communicate it in an effective manner, and I think Hindi would be the right medium to communicate with that, a number of the incidents of the oral cancer will significantly come down. And I'm sure the government anyway, if we all been to movies these days, and we've seen that the first ad in the movie is usually about the oral cancers, and it's rightly so. It's a burden, it should be tackled. Similarly, for a cervical vaccine, I think when you come to a certain social strata, which we see across in our region more frequently, I think most of the parents are aware that a girl child between 9 and 11 years and a male child between 13, 15 years, we end up vaccinating them with a multivalent, that's a quadrivalent HPV strain vaccine, which certainly prevents HPV infection and in turns prevents HPV cancer. The most common HPV cancer, that is human papillomavirus cancers, are cervical cancers and penile cancers and anal cancers and oral cancers. So these are the most common cancers which can be prevented by vaccines. For example, my daughter, I chose but naturally to get an HPV vaccine done, which is the recommended IAP guideline vaccine. So I understand that there are concerns which a minority would have, but I think when you meet a pediatrician and you ask them about the safety of these vaccines, they're pretty safe. So yeah, I think these two steps itself will reduce the oral cancers as well as cervical cancer, which are the two most common cancers in men and women.
Right, sir. And coming on to the treatment, from immunotherapy to personalized medicine, do you believe that AI really helps doctor make better cancer care decisions?
So AI, I think, is part of our lives now. I don't think anybody of us who has an access to a mobile phone, like the way we all Googled, we're all obviously taking the help of the readily available applications which are available on the phone. That's one personal use. There are obviously multitudes of other use of AI in oncology. I would not like to, go into the broader part to it. For example, we are doing a lot of studies in Max Healthcare about use of AI in radiology. How can it help us make our reading better? As a subcontinent, we are a bit late at it. If you ask about any of the Western counterparts, most of the hospitals, they have a number of projects going on AI related, because it has the power to transform the healthcare especially. And I'll not be surprised if VOH does an AI summit also. But
that's a great idea. I just got a lead what to do next.
So I'm sure it will help.
Yeah.
And but coming back to it, reading the mammograms, reading the radiology scans, reading the pathology slides, I think there's a use of AI everywhere. At a very personal level, it helps us research better, making an individual decision. And when it comes to understanding the survival data of one particular intervention vis-a-vis another intervention, vis-a-vis another intervention, and when it requires a deep research, I think it does have the ability to save quite a lot of time. You can't just blindly trust it. It can be a supplementary and a guiding tool. It cannot be a documented statement which you end up making to the patients. You obviously need to cross-verify the checks, the facts. But yes, I would certainly say that at a very personal level, it helps you supplement the research which you're doing. So what happens is, as you grow in your practice, you see a lot more referred and complicated patients. So when you see those patients, they are partially treated or have been treated somewhere, and then they've come to you for an opinion which they feel that their primary care physician has exhausted a lot of options, and they feel that for just out of the fatigue, the physician has hit a thought block. So when they come to you and you're thinking and what next intervention to be done, and you want to dig deep into it, I think it certainly helps to do a deep research and pick up those finer points which possibly would have taken hours for you to do it. It does help there, yes.
Yes, definitely. AI is making our jobs very easy and definitely helps in research. So, what are the major barriers to timely and effective cancer care in India, and what strategies can help overcome these challenges, especially in rural and underserved areas?
I think the biggest barrier is obviously the finances. I should not lie to it. I may work in a hospital which I may see a certain social strata of patients which have been, which have been lucky and they've had the finances for it. But I also come across quite frequently a significant number of patients who obviously struggle to find the finances for this, and it's a concern. And I also come from a part of India. I belong to basically Haryana, and there's a town called as Kalanur there. And my father has been a long time practitioner in that particular area for past 35 years. Whenever he needs my help and whenever he tries to seek an opinion, I think a major concern on his mind is whether the patient he's been trying to seek an opinion for will be able to afford the treatment at a hospital which I work or not. And which I understand and we try to help them as much, but the cost of delivering the care and the cost of the drugs, it's there, and it's not easy to afford these medicines. Yes, there have been government subsidiaries and there have been government hospitals there. But I think because of the sheer size of the patient volume, it's a challenge. So I say that the first challenge is obviously the finances. I don't think it's the lack of skill and the lack of knowledge among my peers and my fellow oncologists. I think it's definitely the finances at the end of it. I think second is general lack of awareness and education, especially in a rural area when they feel that the moment you get cancer, it's almost a death sentence. And as we had discussed about the figures of survivability, the earlier you pick it up, the more likely you are to cure it. So, for a rural person coming from a rural background, when they feel a lump and they fear that it might be cancer, and then you sit on it for next 5-6 months and it becomes a stage 2 and then a stage 3, well, sadly, but the chances of survival are going down by each passing quarter or a month. And it is becoming more and more, difficult to cure and more easy to relapse. So I think that's something which can be done. And I'm sure at every possible level, my fellow medical practitioners, they are aware about it. They are, obviously they're spreading the word. It'll take time, but I'm sure it'll turn around.
Right. Now it's time to tune in for a glimpse into a person behind a white coat. So, sir, what's one myth about cancer that you wish people would stop believing?
That it cannot be cured. I definitely believe. I just hope that they just come to understand it can definitely be cured. Rather, 90% of them are easily cured.
Yeah, it can be. I agree. So, if you could invent one gadget to help patients, what would it be?
I have no idea. I'm not an inventor. But yeah. I'm sorry, I have to pass that one because it'll be a different...
Maybe a wonder drug. Right.
So now when you ask for it, I think if we as an industry can collaborate and do research in India, which I think is my dream. Basically, drugs have two parts to it. There is a discovery to it and there's a development to it. In India, we don't discover drugs. We generally help them develop. I think if drug discovery can happen in India, nothing like it, but I don't think I'm sure there are academic institutes which are at much better place to discover those drugs, but I would love to collaborate with, and as a Max Healthcare, we would love to collaborate with, let's say, the best of universities in India to discover drugs. And I don't know how it's possible, but well, it's a dream.
How would you unwind after a long day in oncology ward?
I was a keynote speaker in one of the national meetings, and somebody asked me, how's your work-life balance? And I told them it's not there. I work too much, and my work-life balance is a bit difficult. But then I have two beautiful daughters. One is 11 years old, one is 1.5 years old. So I wish my 11-year-old would stop growing and my 1.5-year would grow up sooner. So I'm obviously, I love to spend time with them. I love to take them out. I love to take my elder one out to a bookshop, and we generally go to the Bahari Sons and we sit and we look around the books, and I pick up my coffee from there, and I think it's our Sunday routine. With the younger one, I think I wish I could spend more time, but then whatever time I have, I do take her out for a stroll in my locality, in my park. I think that's my unwind.
That's beautiful, sir. So one health habit you swear by?
I'm very, very careful about what I eat. I generally I never overeat. I try to limit my diet as much. And whenever I have time, if I'm on holidays or whenever I have time, it's my thing to go for a run or hit the gym. At least whenever I have time, I think that's something which I definitely do. So a well-controlled and a balanced diet, and whenever possible, engaging in a physical activity is what I generally like to be.
If you weren't an oncologist, what would you have been doing?
I've been in medicine for almost 15, 17 years now. It's very difficult to answer. So if I've not been an oncologist, I would have probably been a physician because I love medicine as an internal medicine. Had I not been a doctor, I probably would have. So there was a career counseling happened when I was in school, and it said that the topmost profession the choice was doctor and second was lawyer. So probably a lawyer, but I don't think I can imagine myself not being a oncologist. And that's because I am very genuinely happy being an oncologist. I love to have a conversation with patients. I love to treat them. I love to sit hours with them to understand their emotional self and their problems. I think it gives me the genuine happiness, and I find a lot of peace in that. So I think it's what keep me going.
Yeah, I believe that is a noble profession, and keep it going, sir. Thank you so much for joining us today for this conversation.
Thank you so much. It's always a pleasure.